Welcome back to Viewpoint. The World Health Organization has reported that Covid-19 is disrupting life-saving immunization services across the world in both rich and poor countries. In Gibraltar, the Director of Public Health says that the ROC's measles, mumps and rubella vaccination rate doesn't look very good. Dr Sohail Bhatti told GBC he's still waiting for the data to be validated, but it could mean further outbreaks of other infectious diseases. He said he believes there are people in positions of influence locally who are sceptical about vaccinations, something that he says needs addressing. Our reporter Shelina Assomull sat down with Dr Bhatti and first asked him how he feels the easing of Covid-19 restrictions is going.
I remain convinced that the chances are that everyone in Gibraltar at some stage will catch this virus. It's all about time, and it may be that people don't get the virus till next year. But this virus, until we've got a way of preventing it, will spread. We've been really lucky. We took, in fact, there was a social lockdown by the people of Gibraltar, which actually stopped in its tracks last time. We were heading for a significant wave. Because the people of Gibraltar took the action they did and they imposed a social lockdown, we did not have that wave. We killed it, we subdued it. However, the factors that led to that initial rise are still valid today. Where there has been a large number of infections, such as Madrid or in London, Lombardy, there have been disappointing figures in terms of immunity, which tends to suggest that less than 1 in 5 people in those areas where we've had hundreds of thousands of cases, less than 1 in 5 of those people have actually had the virus when it comes to measuring serologically blood test of their immunity. So that must mean that that's not a high enough level to protect the population. So I think, because we've had such small numbers, will have a very low level of immunity in our population, and that when we do get viruses, it is almost as if it's day one. I would be surprised if we had more than 5% of our population with immunity against this virus, which means 95% have still to be exposed to it. And the essential issue still remains true today, which is the virus exists, and it exists across our frontiers, whether that's by air, sea or land. And we, as a trading nation who have made a great strength out of our entrepreneurship and our relationships with the rest of the outside world, we cannot erect barriers like other places have, and that means that people with viruses will be coming into Gibraltar continually until we are able to eradicate this virus across the world, and we won't be able to do that without a vaccine.
So, Dr Bhatti, you're essentially saying that more of us will need to and will get it at some point. Is unlocking the ROC to some extent, is there a hope there that people will get the virus? Is that something you'd like to happen so we can move forward in that way?
It depends. Sweden, for example, went through a process where they accepted that the virus would spread. What they didn't manage to achieve, or perhaps had been a bit naive about, was how do you protect your elderly? And this country, this territory, managed to achieve that, and that's why I think essentially we have had, touch wood, no deaths for the moment, because we have managed, through a great deal of effort from lots and lots of people, and including the relatives of the people, we have done what we have done for their sakes. And do I want it to travel throughout our population? Ideally, no. But can I see an alternative? Not unless we have a vaccine. And as I say, the issue is not that there would be a vaccine and it can't be developed. The issue is, would it be a safe vaccine? Because the safety of vaccines is proven with lots and lots of testing. And because there'll be a lot of pressure on people to use the vaccine early, it won't be entirely safe because it won't have had enough time to mature. But when that vaccine is around, and we're still in two minds as to how effective the vaccine will be. Remember, this coronavirus is of the same family that causes 1 in 4 colds. And we've always said that the person that is able to develop a vaccine against the common cold would make a fortune. Well, no one has developed a vaccine against the common cold, so that suggests it's not as easy as we think. And even if we get immunity, we still haven't got enough experience to know whether this immunity would last, which is probably the way coronaviruses work. Our immunity fades. Now, we don't know over what time frame that fades. Is it over 6 months? Is it a year? Is it 2 years? So the vaccine may be the best way to maintain and protect our population, or alternatively having, and people have done this calculation, they said, if you have 60% of the population with some immunity, then you can stop it spreading any further. My concern is the good people of Gibraltar, particularly the vulnerable, and the most vulnerable are the people 70 years and over, and that is where the risk is, to be honest. If we can maintain protection, and I can appeal to the good sense of the people who have done their 70, it's still out there. We still need to behave sensibly. Social distancing is by all means. I mean, it's not just physical distancing. It's about protecting yourself with hand gels and washing. That's the best protection you have, because you can pick it up in handles, you can pick it up on doorknobs. Coughing into your sleeve or wearing a face covering means that you can't pass it and contaminate it to the environment.
You mentioned the elderly. You've often cited that as one of the greater accomplishments in this entire situation, having protected that population. Obviously, that was done earlier through legislation and legally obliging them to stay at home unless absolutely necessary they go out. That's not there anymore. So how are we going to protect them going forward?
Well, partly I rely on the wisdom of the people who've got to 70 are not silly and they're not stupid. They, in a way, they've recognised where the risks are and they've sought to protect themselves. Now, I've got immense sympathy when you want to see your grandchildren, when you want to see your children, you want to hug them, you want to hold them close, you want to feel their warm breath, and all of that represents risk. And the best way that you can manage that risk is meet people with a bit of social distance. Meet them in outside areas, because we know that internal areas provide ways where the virus can circulate. So outside areas are better, the air blows through, the sunlight shines on it. You're in a safer environment, and if you must, and I, great sympathy. We want to hug people. If you must hug your grandchildren, then make sure you're cleaned before and after. We've provided plenty of hand gels. I know some people go to the extreme of even taking their clothes off afterwards and washing them. That's all about protecting yourself, and I appeal to everyone else. The reason we went through this pain, this social lockdown that we all suffered for many, many weeks, is to protect our parents and grandparents. So let's act sensibly about this.
Well, we are here in Casemate Square, a hub for people moving around in Gibraltar. We've seen plenty of people pass us just at the start of our interview. Does this unlocking process worry you?
Yeah, I actually celebrate the fact that we're getting back to a near normality. I think if we're going to have to learn to live with it, this is the way that we learn to live with it. This is not the same society as it was around Christmas. If you walk down Main Street, you'd see large groups of people sitting there, kissing people as they met them, shaking hands, holding hands, hands around the shop. This is, in many ways, more a Northern European society where we're not shaking hands anymore, we're greeting people but we're maintaining some social distance. So there's nothing wrong in us enjoying the fruits of our lovely place that we live. There's nothing wrong with that. Just be mindful that we have only had a skirmish with this coronavirus. It still exists. And actually, as far as the major concerns we had at the time, which were young children, it's not, and the evidence is that, and we continue to accumulate that evidence. Remember, this is a story that continues to be told. I'm told, for example, that we're only 3 children in the United Kingdom, 3 people under the age of 20 that have died. A tragedy for those families and their lost opportunities. But those 3 people under the age of 20 that died were out of 10 million. So we can't eliminate the risk of life, but what we can do is mitigate and reduce it. So we've got to balance our social needs and our social development. We've got to balance our need for our economy and to get reasonable economic activity going, which also has health impacts, against the very real fear we have around coronavirus. We mustn't let it dominate us. It wasn't and never should be construed as a zombie apocalypse, which some papers and some news stories have run.
We saw a substantial jump over the weekend, I think the largest since April. What would it take for us to take a step back from unlocking?
Well, remember that locking and the unlocking process is essentially a decision made by government, and I'm happy to provide help. And in fact, in that government document, I suggested 3 tests that would be used. And the reason that we didn't go for any single test was that it's contextual. So, for example, if we just had the 9 cases pop out of thin air, which is what had happened last weekend, in the context of no other cases, it didn't represent a real risk. And the kind of things that we're looking at is, yes, we are looking at the number of new cases, and the evidence of the modelling we have is anything between 10 to 20 new cases represents areas of heightened risk, not absolute risk. We think that once we're starting to get 20 cases regularly, it's almost too late. So one of the things we look out for then is the rate of increase. And what we're saying is that that rate of increase day after day is above 1 in 7, 14%. For more than 5 days, that's also a sign of risk. It means that the trajectory is upward, and what we're trying to do in that trajectory is to stop it ever getting to the woof stage, that zoom stage. So even when it's low, it can go like that very quickly. So we're looking very carefully at that, and we're also looking at a larger number of active cases. And based on our experience of our last mini epidemic, we think that about 1,000 cases, and remember this is contextual, so because we're swabbing far more, we're likely to see a lot more. So again, whilst 1,000 cases looks like a lot, it's in the context of us swabbing between 1 and 3,000 cases a week. So in that sense, that's what we're looking at.
Well, you've mentioned you are swabbing more. We've seen different percentages on the population tested over the course of this pandemic. Now that frontline workers are being repeatedly tested, that could confuse how many have just been tested the once. Do you know the number for that?
Yeah, so actually the number of people that have been repeats tested is not that large, it's only a few hundred. We are keeping tabs on that. What we've undertaken to do is we've provided some form of stratification of risk. So there's no point in swabbing the whole population because we'd hardly find anything and we'd waste a lot of swabs. So we have to tailor a strategy based on the number of swabs we have, the number of tests we have, the number of people we have to be able to swab it. And what we've done is people who are frontline workers. In other words, frontline is really defined in terms of the number of people that actually meet lots of other people. So that might include shop assistants. It might include bus drivers, it might include rock heroes, deliverers, or it might mean people working in the police or the Borders and Coast Guard or Customs. They meet a lot of people. So for them, we are anticipating screening them one in 7. So that means that 1 in every 7 weeks we'll have done everybody. And we're doing it more often in those people that are facing other people that are more vulnerable. So hospital workers, the people that work in the GHA, the people that work in ERS, the people that work in the care agency, people that provide personal care. That means the social distance can't be maintained in terms of 2 meters. We're screening them 1 in 4. So in a whole month, we will screen the entire group. Now, there's logistic difficulties around that because people have time off. And there are also planning difficulties because if we screen someone and someone in the entire shift is scored as positive, that can take the whole shift out. Again, I'm grateful for the help that an awful lot of people have provided in making a lot of this happen. Everything from actually, to be honest, the leader of the opposition and the opposition party, to the chief minister, to the ministers, to people like myself who work in all the various organisations, all the way through to the frontline workers who do the actual swabbing and do the actual testing.
Well, there's been a lot of testing of frontline workers, as you said. Will there be any more testing of non-frontline workers? Are there any plans for testing of the wider community?
So there's 2 things around that. One is, what are we testing for? So at the moment what we're doing is testing for actual virus particles, which is what the back of the throat swabs are. These are cotton wool buds with a long end on them. Some of them have got soft tips depending on which variety we're using. That tells us if you currently have virus. It doesn't tell us whether you were infected last week. It doesn't tell us whether you will have the virus next week. It just tells us if you've currently got the virus. So it's got a very narrow window, and therefore if we did the whole population, what would it tell us? It wouldn't tell you. If I went to anyone, yourself, and took a swab from you and it was negative, what would that tell you? Would it tell you whether you had been infected yesterday, or whether you were going to be infected, or whether you were incubating it? So that's one test. The other test, which people have talked about, the Abbott test, the Chief Minister's referred to, which is an ELISA serological blood test that tells you whether you've got you've been exposed in the past and you've developed an immune response to it. That is a blood test, so it's not a swab test. You have to take blood off of people, and it tends to only turn positive after 30 to 40 days of your infection. Okay, so I could do a test and it would be negative, and again, is it because you were exposed to it or not exposed to it is a big question. Yes, if you had clearly some symptoms and we were able to relate that to some infection you had 2 months ago, we might be able to say yes, you were exposed to it. But a negative test in itself wouldn't tell us very much. In addition to which, the response fades over time. So what we don't yet know, because we haven't been around long enough, is over what time frame does it fade. So all these complex factors mean that we have to use the tests in an appropriate way. So if you phoned 111 and you had some of the symptoms, if you had a headache, burning eyes, you had a sore throat, you had a dry cough, you had a fever, you had lost your appetite, some of the other symptoms are on the website, then you could phone up 111 and they would arrange for you to go through the swabbing. We never stopped doing that. So if you have symptoms, you can still pick up the phone, 111, appointment will be made and you will be tested. And that has never stopped. It's just the numbers have gone down because people have got less symptoms.
Contact tracing, is this actually being done, and can you explain the process as it is happening now?
Contact tracing is a really complex set of activities. So at its most simplest level, if you have been found to been in a position of exposure which is considered to be risky, which is 2 meters or less for 15 minutes, and you then are found to be positive, then the person that you were within that distance in the last 2 days is also deemed to be at risk. So we have to find from you who you had been with in that distance frame for the last 2 days. So that's quite an intensive process. You know, how many of us can remember everybody? So that process itself is not 100%, but it has been working for at least 2 weeks.
Do you feel like the number of those self-isolating tallies up with the cases?
Yes, so we are reporting potential cases, not self-isolators. So there's a difference here. The people that are self-isolating because of symptoms. There are another bunch of people that are isolating because they are potential cases, and that's a different cohort.
So we don't receive that number every day, that's not included?
I think that is part of the developmental process we're putting together for the Contact Tracing Bureau. It's a developmental process, we haven't quite got it right, and it would be unfair to report that when we're not yet sure of all our figures. But that is something we will share when we are assured that our figures are correct.
On the subject of masks, the government is now advising the use of them in enclosed spaces such as supermarkets. Initially, in the early stages of the pandemic, you would say the advice was dismissive of masks. Now advocating the use of masks, how difficult is it to get this message across?
I'll explain that very simply. I actually said that we should be wearing masks in spaces, enclosed spaces where people weren't able to maintain social distance. I think it was 4 weeks ago on a government information session that was broadcast, and it was picked up by GBC and it was explained at that time. We felt the need to repeat that information because it was clear there was confusion. But outside spaces are generally safe according to the evidence that we have. Inside spaces are less safe, and where you can't maintain social distance, wear a mask. But in the hospital we can maintain social distance, so we don't wear masks. And in other departments where you can maintain social distance, you don't need the masks. Remember, the masks are not about protecting you. The purpose of the mask is to protect your parents and your grandparents, because you stop any asymptomatic virus spreading into your environment, passing to someone else who then passes it in a hug to their parents or grandparents. This is another layer of protection. Masks itself make a marginal impact. By far the biggest impact is hand cleansing and hand washing, and we've been consistent with that. So I think I did what the evidence indicated.
Okay. Now, the World Health Organization has reported that COVID-19 is disrupting life-saving immunization services across the world in rich and poor countries alike. Syphilis, measles, polio, to name a few. Has there been any disruption to regular vaccinations in Gibraltar?
One of the things I wanted to keep going when we had COVID coming was childhood vaccination, and I'm grateful, the teams went out, they've been to schools and settings where the children are, and they've done a sterling job. I actually have just asked for some analysis of the vaccines, and we're still double checking, but it does look like, for example, our MMR rate is not very good. Yeah. So I think it'd be unfair to say just how bad it is, because I'm still waiting for the data to be validated. But there doesn't appear to be as enough to protect our population, so we could have further outbreaks of other infectious diseases. So I say I need to find out, and then we need to revamp some of our activity around this. And again, I've seen the good sense of the people of Gibraltar. I'm sure they will rally and address that. And if I can persuade people, make sure your children are protected. After all, we've done this for our parents and grandparents. Let's do something for our children and try to get them as protected as possible. Measles is one of those horrible diseases that can lead to encephalitis. I've seen a child whose brain has dissolved 10, 14 years later, 20 years later, because they got real measles, they didn't get the vaccine. And it's not a pleasant thing, not a pleasant consequence.
Getting vaccinated isn't compulsory here on the Rock. In a Daily Mail article, you're cited saying you believe that they should be compulsory vaccines. Do you believe they should be compulsory here?
So I was an executive director where the board that I was working for made that decision. So it wasn't me that made the decision. The report misreported me. I've never been a GP. You know, there's all that sort of misreporting going on, and there was a degree of an interest in a story because at that time there were certain states in the US as well as France that had made it compulsory for people. Remember, like what we're doing with masks, is that we're often protecting other people. That's what the vaccine does. It protects not just our child, but it protects the population at large, and it protects particularly those children who can't protect themselves. They sometimes have immune deficiencies they're born with, or they're suffering from cancer, and therefore part of our civic duty is to protect our children. That's our parental duty, and part of our civic duty is to protect others. I think it's a debate to be had, to be honest, because we know in other places where you do make it compulsory, people stop sending their kids to school, and that would be disastrous too. I don't think there's a need to call for it to be compulsory at the moment, but what I do want is a vigorous discussion and a debate, because I think there's a very vocal minority that creates a lot of antipathy and anxiety, sometimes not always well informed, that creates fear and anxiety in people's minds. And parents want to protect their children, so when they see this, they think there's a lot of uncertainty. There really isn't that much uncertainty around it.
There is, however, an anti-vaxxer movement growing across the globe. What sort of foothold, if any, do you think this has in Gibraltar, and what can be done to combat this kind of misinformation?
So I don't think it would be appropriate for me to say whether there's an anti-vaxxer movement in Gib or not, but I can certainly see that there are people who are resonant to the messages that are sent out. I mean, a lot of this is often misinformation, and people have reported that there are Russian bots that are trying to influence thinking elsewhere. People don't necessarily always wish as well, are trying to, there's a global battle going on, if you like, and we sometimes pick up some of that information. What I am surprised about, and I think there's a conversation I've had with the other regulator, so the two regulators, the Medical Registration Board and the Nursing Registration Board, will be looking at the importance of healthcare professionals not to dismiss the importance of vaccination. And regretfully, I think there are people who have positions of both influence and power who are sceptical, and I think we have to start by educating and discussing and having that dialogue within the GHA and its various services, and we can perhaps then begin to address the wider issues around that, because remember, everybody knows a nurse, everybody knows someone that works in the GHA, and that if we can win that battle there, have that discussion, then I think we're well on the way to having a meaningful dialogue. And if that means registration issues, disciplinary issues, that's way downstream. But this is more about education and empowering the silent majority that I think that do believe in vaccination, because the figures bear that out. Their parents are making choices for those children. Those children have to bear the consequences of those choices, often not just for a few years, but for the rest of their lives. And we know that in order to end this COVID pandemic worldwide, we will need to vaccinate. And therefore we need to have a discussion about the importance of vaccination as ending this pandemic, and therefore out of that comes a dialogue about childhood vaccination.
So Dr Bhatti, a lot has been done, but still there is more to go. What are your concerns and what's keeping you up at night right now?
If you can park the issues that we've just talked about as keeping me up at night, I think the issue that has risen most has been a lot of the lifestyle issues that, so clearly there is an impact in being overweight because we know there's an increase in deaths from COVID. There's a whole bunch of issues around alcohol, tobacco. It remains a big issue for our population, why we would wish to harm ourselves. The whole thing around addictions and how we manage those addictions. I see a really generally happy population, but we self-medicate an awful lot. So I have to ask myself, why are we self-medicating? And actually some of the things we're self-medicating on, sometimes not just self-medicating ourselves, but getting it from the medical profession, aren't necessarily always good for us. And if we can find other ways to address those needs, then this is a utopia. And people are really lucky to live here. Let's just stop harming ourselves through the indulgences and the bad behaviours that we fall into as we grow older.
Lots to chew on in a very interesting interview. The Director of Public Health, Dr Sohail Bhatti, speaking to our reporter, Shelina Assomull. Viewpoint will be back at the same time next week, and we expect to focus on contact tracing. For now, though, thanks a lot for watching, and good night.